HLA genes are a numerous and quite varied group of genes that exist on chromosome number 6. HLA genes code for the formation of molecules that are on the surface of all of your cells throughout your body. These are called major histocompatibility complexes, and they serve two purposes. The variation in these genes allows the body and the immune system to decide whether a cell with all of these markers on its surface are self, or whether it's something foreign that needs to be attacked. The second function of the HLA genes is to actually capture bacteria or viruses and present them to the immune system for eradication. Well, you can see here where the variation in HLA genes becomes so important, because if everybody had the same exact HLA genes and a virus or a bacteria mutates and is able to get around the presentation of viruses and bacteria to the immune system, it's quite possible that a single virus or bacteria could wipe out an entire population. So it seems over time, nature has found ways to try and have reproduction account for the changes and variation in HLA genes. There are studies that actually show that certain patients with certain HLA genes have a scent that actually attracts a spouse with a completely different set of HLA genes, helping to perpetuate the variation in HLA genes in the offspring. But when this fails, it seems that reproduction has a second mechanism which is very important. It seems that the more similar the HLA genes are in the embryo to the mother, the more difficult it is for the embryo to turn off the maternal immune system. There are many documented cases of matches between the husband and the wife that lead to almost complete failure to conceive or multiple miscarriages. We know the mechanisms, we understand the cells that are not being turned off, and this can be successfully treated. It's also important to understand that it's not just the matching that's important between the husband and the wife, but sometimes just the presence of certain HLA genes in the mother that can dictate a predisposition to recurrent pregnancy loss. We've also identified many of these genes. We understand the mechanism of action, and this also can be treated. So it's important to understand that we're not just looking for a single match of one of the HLA genes, but a significant number of matches. There are patients who come to our practice who've been told they have a single match, and therefore this is the cause of their recurrent pregnancy loss, and this really couldn't be farther from the truth. So it's very important that when you get your HLA matching done, that you measure the entirety of the HLA genes and not just a single HLA gene. And it's also important that whoever is analyzing these HLA genes understands that there's different nomenclature used by different laboratories. Some use antibody testing, some use amino acid sequencing, and the numbers can look different depending on how these reports are generated. It's possible, if not correctly analyzed, you can overdiagnose matching, or in some cases miss the matching altogether and then fail to get the appropriate treatment.